Hello, my name is Aaron Munns. I'm the Veterans Director at the Mesothelioma Center at asbestos.com. And here is part one of a four-part series designed to instruct veteran service officers how to help the veterans in their communities with asbestos-related claims. The first section is components of asbestos diseases. The second is the VA decision criteria for asbestos claims. Our third class is nexus statements for asbestos diseases, and the fourth is asbestos exposure summaries. First off, the VA recognizes that several different conditions can be caused by asbestos. It's not just mesothelioma cancer. The VA recognizes pulmonary fibrosis. The most common is interstitial pulmonary fibrosis or asbestosis. Several different types of tumors. Pleural effusion, which is fluid buildup in the pleural space between the lungs and the rib cage, and pleural fibrosis. Pleural plaques, which is calcified scar tissue on the pleural lining, again outside the lungs, in between the lungs and the rib cage. Mesothelioma cancer of the pleura and the peritoneum. The pleura is the lining around the lungs. The peritoneum is the lining around the abdominal organs. They also recognize that cancers of the lung, bronchus, gastrointestinal tract, larynx, pharynx, and the urogenital system, except the prostate, can all be related to asbestos. For all of these diagnoses, with the exception of asbestosis and the mesothelioma cancers, a well-written and substantiated medical nexus statement is required to link the cancer to the asbestos that was a contributing cause of it. That's part 3 of this training. It's also important to note that anyone who has a significant or advanced asbestos lung disease has a compromised pulmonary system, which puts stress on the heart and the cardiac system, and they can develop a condition called cor pulmonale, heart disease, which is secondary to the lung disease. So many veterans who have lung disease will die from heart failure secondary, and you can get that cor pulmonale service connected as a secondary condition to an asbestos lung disease. Asbestos does not cause medical issues immediately. The latency period for asbestos ranges between 10 and 45 years or more from the time that the veteran was first exposed to asbestos to when they developed the disease. As a result, the vast majority of veterans that I work with are diagnosed decades after their service. So establishing the connection between what their current diagnosis is and when they were exposed while they were on active duty is a challenge at times, and that's why this process is so important. The exposure does not have to be lengthy. Typically, many of the veterans that I work with had several years of exposure, but it's also possible to have much less exposure to asbestos, which causes health issues and negative health outcomes decades later. Everybody's physiology and biology is different, so making that medical connection and having the doctors understand their exposure so they can get an accurate diagnosis is important. And then it's important to note that smoking does not prevent an asbestos-related claim from being approved by the VA, but the VA does not recognize that COPD, emphysema, and chronic bronchitis are primarily caused by asbestos. Many of the veterans that I work with are diagnosed with COPD first. It's much easier to identify and treat from doctors. All it requires is a breathing test and an evaluation of their symptoms. They're given an inhaler and told to come back in a year. Many times the doctors do not dig deep enough to see if there is also asbestos lung disease that is contributing to breathing problems. So digging deeper to realize and figure out if asbestos is causing part of the veterans' health problems is critical. Mesothelioma cancer is a very aggressive cancer. It is not lung cancer. It affects the outer lining of the lungs in about 70% of cases. It affects the lining around the abdominal cavity, the peritoneum, in about 25%, and the final 5% are split between pericardial mesothelioma, the lining around the heart, and testicular mesothelioma, which affects the lining around the testicles. It's not testicular cancer, it's the lining. Most commonly, the cause is asbestos exposure. And out of the 3,000 cases of mesothelioma diagnosed in the United States each year, about 30%, or almost 1,000 of those cases, are military veterans. And that's because of how widely asbestos was used across military branches throughout the 1930s through the late 1970s and even beyond. It's very aggressive, so patients who are treated by specialty centers that have experience and repetition in treating patients usually have better health outcomes, and our team can help them connect to asbestos mesothelioma cancer treatment centers around the country. So that's something that we can assist with. For diagnostic testing of any asbestos lung disease, which is most common, the veteran needs to have both chest imaging, which usually starts with a chest x-ray, but preferably a CT scan or an MRI show a lot more definition and detail about the lung health, as well as a pulmonary function test, spirometry, which measures lung function. You have to have both of those done to accurately diagnose an asbestos lung disease. A pulmonologist or a pulmonary lung specialist is best trained to diagnose either a restrictive lung disease, which is the scarring on the outer lining, the pleural lining of the lungs, or an interstitial lung disease. That's the fibrosis and asbestosis, damage to the lung tissue inside the lungs. And a pulmonologist can differentiate between COPD and asbestos lung diseases. To diagnose an asbestos-related cancer requires both a tissue biopsy and a pathology report, which states the specific tumor type or cell type of the cancer, as well as a nexus statement for any cancers besides mesothelioma. If you have any questions or have a veteran you're working with that you would like to connect them to our team so we can provide additional information, or if you'd like to connect with us to assist with a VA disability claim that you are working on, please let me know. We are a free help center. I'm a veteran myself. Please let us know how we can help.